in the next 6 months, what did all you as employers, group plan sponsors, union plan sponsors need to do with some of those immediate reforms? What is Blue Cross? How are we going to implement all of these things? That's going to be the main focus of the discussion. But I'm going to do a little bit of setup before that. It might be a little bit redundant, but hopefully it gives you just a little bit of context. So I got a lot of words. Justine's actually slides are much better looking than mine. I have too many words, but I just want to make a couple of points. You can see by the degree of change, scope, provision, timing, all of these things, that there's just going to be a lot of change. And so that's why we want to take this opportunity. And we know that you all will be going through a lot of change. People at your organizations will say, what are you doing about this? So we want to make sure that as we learn things, as we get information, we're sharing that with you, because we know it's going to be a wild ride over the next several years in healthcare. There's a lot of changes in the future, but like I said, I think focusing on immediate benefit changes, what we, Blue Cross, are doing to make those changes happen, and cover a little bit of overlap with Justine's presentation, some of the administrative things you need to do outside of the just the administration of healthcare benefits. So let me start with this sort of a picture. I'm sort of thinking about there's really 3 phases to how this is going to feel going through the process. And number 1 is regulatory turbulence. I've told some other people that it's sort of like, when they enacted the law, that's when you're sitting on a plane and it bumps, and then the first officer comes on and says, fasten your seatbelts, please return to your seat, because it's going to be a little bit rocky. And so that's why I kind of like the word turbulence here, because new regulations are going to come out. We think we know what the law meant, and the regulation comes out and turns it on its head. So we're going to have to react, get information out to you all as we can. A lot of the big changes that change the financial incentives, this pay-or-play, subsidies, the obligations, how the healthcare system is working, the requirements for benefits, a lot of that happens in 2014, so we think there's going to be a lot of market turbulence. There will be companies coming in and saying, here's a different option. You all will be saying, well, why don't I try this, because there's a new set of incentives around there. And then eventually, there'll be a new normal. The new normal will probably look different than it does today. There'll be more change than there is today, but that probably won't happen for quite a long period of time. And I think there's going to be a lot of changes, and like Justine said, there's going to be both a lot of changes in how the market reacts, but then how the policymakers then react to what the market's doing. Say, that's not how we want things to go, and I think there'll be a lot of back and forth there. And when we look forward to 2014, this is the only time I'll sort of talk about the future there. There's really things that are shaping the market here. We talked about pay or play, and sort of that employer responsibility, they're calling it, to offer coverage. People are required to buy coverage or have penalties. The method that people buy as individuals and small businesses will change on the exchange. Cost-sharing subsidies will change the dynamic about where it's best for people to get their health coverage. Medicaid's going to expand. And what's required for minimum essential benefits is going to change. And you put all those things together, and all of the choices that you all, as plan sponsors, the dynamics of those choices are going to change. The dynamics of the choices that individuals will make when they're buying insurance. Someone's got to pay for all of this, and there's going to be a lot of pressure on people are actually delivering their care, doctors, hospitals, that sort of thing. So that's why I sort of think as if when you were a kid, if you ever played that game Boggle, right, and there's all the things in there, you shook it up and you looked for new words. It's getting shook up right now. So our commitment to you is we know that this is going to be a big change. It's really a structural change to the market at every point in the healthcare insurance and delivery system. And so our commitment to you is that we will continue to work with you to provide solutions and information to help make the best decisions as this thing evolves. So that's my little take on where the future is going, and the buzzword is change, and we're here to try and help that.